what I want to share with you is pretty straightforward. If you're a practicing physician, this is for you. I wish every practicing physician actually will get a copy of the physician's copy of my new book. They were in two sets. The one called COVID-19 Physician Treatment Strategies. I wish you will get that book because there's so much drama going on and we cannot afford to be seen as incompetent or lacking the knowledge that we need. There's a lot of drama going on. If you look at our diagram I'm going to show you, you'll see the drama. If you can take a picture of this on the video, good. This is the drama that's going on right now, and it's not irresponsible. It's an indicator of how irresponsible some groups of people have become. And unfortunately, patients are suffering. Lives are being extinguished because of not having the right information. Okay, I'll say this. I'll say at the beginning, I'll say at the end. If you're a busy physician, we are all too busy to sit down and piece the facts together and practice medicine at the same time. So we're not going to be able to get to 100 journals like I did. It's not going to be possible. Very few people read that many journals in a month or in a year. So reading that in a short period of about a month or a week or a few days, it's going to be impossible. That's why I say get the book COVID-19 Physician Treatment Strategies. It's on iTunes and a few other platforms. If you type in my name, Cax Nopere MD, you'd find the book. And, if you're a doctor and you're relying on biased articles like the two published in the Lancet and the New England Journal by an entire professor of medicine, you have to retract that paper for lack of sufficient data, even though they had 96,000 plus and they call it a robust trial. It's not a trial. It's just collecting information like a data entry situation. So it was shown and it was withdrawn. It was published and it was shamed. Okay, I learned extensively from a gentleman called Professor Bert Spilker, as well as his contemporary at McMaster University, Professor David Sackett. Professor Bert Spilker was one of the consultants at Burroughs Wellcome at University of North Carolina, Chapel Hill. He was a professor there too. And like I said, they'd be appalled to see any doctor coming on the media on television saying that hydroxychloroquine doesn't work because there is no formulation for that proposition. There has no sound basis. And so when a doctor says that in public, he's really saying he's ignorant, okay? You can't say hydroxychloroquine doesn't work or that there is no evidence to support its work. Any doctor that says that has a fundamental information mismanagement problem. Whether this is due to leftist tendencies, misinterpretation of data in journals, proper interpretation of misleading or outright just biased journals, hatred of President Trump, or is irrelevant. How to discern what works is not to be left to the media and a bunch of people who have a secondary agenda to profit. Every doctor knows and must know what can work with COVID-19 infection. And that's why we studied pathology. We studied physiology, biochemistry, public health, epidemiology, statistics, pharmacology. It's so basic. And so it's not a question of whether hydroxychloroquine works, but you as a doctor, your job is to figure out why hydroxychloroquine works. Not look for mediocre papers that say it doesn't. It's your job to figure out, even if hydroxychloroquine doesn't work, what else can work to prevent mortality and admission into the hospital in COVID-19 patients. That's your job, okay? That is why doctors are in medical school first, not just given a prescription pad and measuring how honest they are, and then given a list of diseases as well as a treatment paper to cover each disease whenever they see it. That's not what medicine is. Practicing medicine requires that you have the fundamentals, and there's a reason why you did pathology, pharmacology, biochemistry, virology, microbiology, parasitology. There's a reason why you did those things. It's because of times like this, so that when they happen, you'd be prepared to handle even diseases that you've never seen before. But instead, we're going on the TV talking about how to use a mask. Absolutely unacceptable for the standards of my medical school and your medical school, most likely. Okay, I'm going to say two things here. Get the book, Physician Treatment Strategies. If you don't get that book, and you are not on the front line of research and know exactly why chloroquine works, what it's used for, and the reasons why it affects certain immune modulation cells in the body, then you're going to be left behind. So if the patient becomes hospitalized before you start hydroxychloroquine, first of all, you've waited too long, regardless of what the EUA says. Number two, you should never let a COVID-19 patient become hypoxic before you start treatment. If you've done that, you've been negligent. Number three, the CDC has next to zero information on how best to triage, test, and treat COVID-19 patients. That book has that. There's a new formula called the alveolar correlation score. In that book, it will show you exactly how to triage a patient and who to start treatment on right away without even having a blood gas. And you'll be able to figure out why you are treating that patient and have a justification for it. Okay. The book, Physician Treatment Strategies, saves doctors, particularly practicing doctors, hours or tens of hours of time that you have to waste combing through journals that you're not even sure they're biased and will be withdrawn. It's true that COVID-19 is a dynamic disease, but it doesn't change the pathophysiology. And it's from the pathophysiology that you decide how to manage it. And I think that if you don't want to waste time, if you really want to have a handle on this disease and help your patients, you'd get COVID-19 Physician Treatment Strategies. If you don't, chances are when your patients do, and when a lawyer does get a hold of that book, you'll be in trouble for not prescribing it. This is Dr. Kaxno Perry. This is a serious matter. We have a pandemic on our hands, and we've got to be willing to learn and go back to the elementary things, my dear doctor. Have a wonderful day.